Today we're going to talk about plasticity after brain damage, Module 4.3. Almost all survivors of brain damage show behavioral recovery to some degree. Some of the mechanisms rely on the growth of new branches of axons and dendrites, similar to the mechanisms of brain development. Understanding the process leads to better therapies for people with brain damage and contributes to our understanding of brain functioning. Brain damage and short-term recovery. Possible causes of brain damage include tumors, infections, exposure to radiation or toxic substances, and degenerative conditions such as Parkinson's disease or Alzheimer's disease in young people. In young people, the most common cause is a closed head injury, or a sharp blow to the head that does not puncture the brain. The effects of closed head injury depend on severity and frequency. Many children and young adults sustain at least one mind blow to the head from a fall, a bicycle or automobile accident, or even a sports injury. You could reduce the harm from a stroke. A common cause of brain damage, especially in older people, is temporary interruption of normal flow to a brain area during a stroke, also known as a cerebrovascular accident. The most common type of stroke is an ischemia, the results of a blood clot or other obstruction in an artery. The less common type is a hemorrhage, the result of a ruptured artery. Effects of strokes vary from barely noticeable to immediately fatal. In ischemia, the neurons deprived of blood lose much of their oxygen and glucose supplies. In hemorrhage, they are flooded with blood and excess oxygen, calcium, and other chemicals. Both ischemia and hemorrhage lead to many of the same problems, including edema, which increases pressure on the brain and the probability of additional strokes. Both ischemia and hemorrhage also impair the sodium-potassium pump, leading to an accumulation of sodium inside neurons. The combination of edema and excess sodium provokes excessive release of the transmitter glutamate, which overstimulates neurons, damaging both neurons and synapses. There are immediate treatments. As recent as the 1980s, hospitals had little to offer to stroke patients. Today, prospects are good for ischemia. If physicians act quick, a drug called tissue plasminogen activator, or TPA, breaks up blood clots to get a benefit. A patient should receive TPA quickly, at least within 4.5 hours after a stroke. Emergency wards have improved their response times, but the limiting factor is that most stroke victims don't get to the hospital quickly enough. All right. Increased brain stimulation. A behavior deficit after brain damage reflects more than just the cells that died. After damage to any brain area, other areas have lost part of their normal input because they're less active. For example, shortly after damage in one brain hemisphere, its input to the other hemisphere declines, and therefore the other hemisphere shows deficits. Diakinesis refers to the decreased activity of surviving neurons after damage to other neurons. If diakinesis contributes to behavioral deficits following brain damage, then increased stimulation should help. In a series of experiments, Feeney and his colleagues measured the behavioral effects of cortical damage in rats and cats. Depending on the location of the damage, the animals showed impairments in movement or depth perception. There's the regrowth of axons. Damage to the brain or spinal cord damages many axons and neurons that survive the damage. Getting those axons to grow back and connect to the correct targets could offer a great benefit. In principle, axon regrowth would seem to be possible. Damaged axons in the peripheral nervous system do grow back at a rate of about 1 millimeter per day, following its myelin sheath to the original target. Damaged axons also grow back in the spinal cord of a fish under the control of a gene that is active in glia cells. Axon sprouting. Originally, the surface of dendrites and cell bodies is covered with synapses, and a vacant spot doesn't stay vacant for long. After a cell loses input from an axon, it secretes neurotrophins that induce other axons to form new branches, or collateral sprouts. Collateral sprouts that take over the vacant synapses. In the area near the damage, new synapses form at a high rate, especially for the first 2 weeks. Denervation supersensitivity. What is this? Neurons make adjustments to maintain a nearly constant level of arousal. After learning strengthens one set of synapses, other synapses weaken. Conversely, if a certain set of synapses become inactive, perhaps because of damage elsewhere in the brain, the remaining synapses become more responsive, more easily stimulated. This process of enhanced response is known as denervation supersensitivity, or receptive supersensitivity. Denervation supersensitivity has been demonstrated mostly with dopamine synapses. Denervation supersensitivity, helps compensate for decreased input. However, when either collateral sprouting or denervation supersensitivity occurs, it can strengthen not only the desirable connections, but also undesirable ones, such as those responsible for pain. Unfortunately, many treatments that facilitate the growth of axons in a damaged spinal cord also lead to chronic pain. This has not been always resolved. Physicians have also had problems with sensory representation in the phantom limb. Physicians have long noted that many people with amputations experience a phantom limb, a continuous sensation of an amputated body part. That experience can range from tingling to intense pain, either occasionally or constantly. People can have a phantom hand, foot, or any other part of the body. The phantom sensation might last for days, weeks, or a lifetime. Until the 1990s, no one knew what caused phantom pains, and most physicians believed that the sensations came from the stump of the amputated limb. However, removing more of the limb in an attempt to eliminate the phantom sensation accomplished nothing. Modern methods show that phantom limbs developed where the relevant portion of the somatosensory cortex reorganizes and becomes responsive to alternative inputs. For example, suppose axons representing the face become too active in the cortical area previously devoted to a mutilated hand. A touch on the face now produces a facial sensation, but it also produces a sensation in the phantom hand. Okay. So you got the somatosensory, which would be at the top of the brain, top middle, the body. And in the middle of that would be the hand. Um, okay. Sometimes a person or animal with brain damage appears unable to do anything or do something, but it in fact, it's not that it's not trying. Consider an animal that incurred damage to the sensory nerves from the forelimb to the spinal cord. The animal no longer feels the limb, although the motor nerves still connect to the muscles. We say the limb is deafferentated because it has lost its afferent sensory input. A monkey with a deafferentated limb does not spontaneously use it for walking or picking up objects or any other voluntary behaviors. At first, investigators assumed that the monkey was unable to use the deafferentated limb. In a later experiment, however, they cut the afferentated nerves of both forelimbs. Despite this more excessive damage, the monkey used both of its deafferentated limbs to walk, climb, and pick up food. Apparently, a monkey fails to use a deafferentated forelimb only because walking on three limbs is easier than using an impaired limb. When it has no choice but to use a deafferentated limb, it does. Similarly, one treatment for people recovering from a stroke is to force them to use the weaker limb by preventing them from using the normal limb. Therapy for a person with brain damage begins with careful evaluation of a patient's abilities and disabilities. For example, someone who has trouble carrying out spoken instructions might be impaired in hearing, memory, and language, or even muscle control or alertness. After identifying the problem, a physician or therapist or occupational therapist helps the patient practice the impaired skills. Okay. Behavioral recovery after brain damage is effortful, and its recovery is precarious. A person with brain damage who appears to be functioning normally is working harder than usual. The recovery or recovered brain behavior deteriorates, marketed after drinking alcohol, physical exhaustion, or any other types of stress that would minimally affect most other people. So in summary, brain damage has many causes, including blows to the head, obstruction to blood flow to the brain, or a ruptured blood vessel in the brain. Strokes kill neurons, largely by overexcitation. During the first hours after an ischemic stroke, tissue or plasminogen activator, or TPA, can reduce cell loss by breaking up the blood clot. However, not many patients get treatment in time for TPA to be helpful. Many procedures for reducing the effects of nervous system injury have shown promise with laboratory animals, but so far none of them have been reliable or helpful with humans. One reason is that many of the treatments are effective only if administered properly after neuron system damage. Also, many patients have additional health problems, not just a stroke or other damage. When one brain area is damaged, other areas become less active than usual because of their loss of input. Stimulant drugs can help restore normal function to these undamaged areas. After an area of the CNS or central nervous system loses its usual input, other axons begin to excite it as a result of either sprouting or denervation supersensitivity. The anatomical reorganization is helpful in some cases, but not always. The phantom limb experience occurs because axons from another part invade the cortical area ordinarily devoted to sensation from the now lost body part. Stimulation of the other body part now produces sensations as if it has come from the amputated part. Many individuals with brain damage are capable of more than they show because they avoid using skills that have become impaired or difficult. Thank you for listening. I hit subscribe for more videos like this.